made to sit for 20 to 30 minutes without tension, without smoking, without alcohol, without anxiety. Then only you're usually when we are seeing OP patients, they come in a rush and they climb 2, 3 floors, and sometimes uh, they come in a speed. So sometimes we check the blood pressure immediately. The blood pressure may be little high, 160 or 170, but in fact they are non-hypertensive. So what we do is we make them sit for 10 to 15 minutes in the OPD, recheck. Many of the time the BP comes down to normal. So as a rule, whenever you are checking anybody's blood pressure, you should make them sit for at least 15 to 20 minutes. And as I said, they should not have had coffee 1 hour before, alcohol 1 hour before, stress, strain, exercise, heavy meal, all these things should not be there. Then only you can check the blood pressure. That is only the accurate measurement. And coming to the apparatus, different apparatus that we use, sphygmomanometer, that mercury-related BP apparatus should not be used anymore. Should not be used anymore. All these Android, and the digital and the electronic, these are all equally good. Once you calibrate these instruments to a normal thing, you can jolly well use. They are very good. They are very appropriate, correct measurement they show. They show correct measurements, but the mercury-related BP apparatus should not be used according to WHO guidelines, because 50,000 people are dying every year in the world because of the mercury poisoning. That's why the WHO has warned that no medical instruments, not even thermometer, should be made of the mercury. But still, many countries, they don't use this mercury thermometer or mercury BP app. Only we are still using. So if you want to buy a BP apparatus, please don't buy the mercury wala. So buy an electronic. They're equally good, digital. Because why should you really establish the diagnosis of hypertension? Because the treatment of hypertension is lifelong. It's not just 1 week or 1 month or 1 year. You have to give treatment for one lifelong. Therefore, diagnosing properly is very important. You cannot give to patients who are not hypertensive. So you make sure you're really dealing with a real hypertensive patient. And one reading is not enough. You have to at least establish the diagnosis, establish the elevated BP recording, at least on 2 to 3 separate sittings. So I don't mean that somebody is coming at 200, you tell them to go and come back after 3 days. No, you make them sit for some time, recheck. But before checking, before confirming, before labeling them as hypertensive patient, you should take at least 2 or 3 readings. Then only you are entitled to start the treatment. Because once you start treatment, it has to be given for ever. And the measurements should be accurate. You cannot have a higher unwanted pseudo elevation of the blood pressure. Patient should be sitting position. The arm should be at the heart level. You have to, the speed of the bulb also, the inflation of the bulb also at a particular given, not more than 2 millimeters or not less than 2 millimeters per second. That is the speed of your lowering the mercury column. So these are the very finer points. Otherwise, you get a wrong blood pressure reading. And especially when we are dealing with obese patients, sometimes we use very obese patients, sometimes use ordinary. We have different cuffs of BP apparatus. You have pediatric, you have adult, you have obese cuffs also is available. So if you are using an ordinary cuff to a very huge person, obese person, you may get a wrong BP recording. So therefore, the selection of the BP cuff is very important. And
one doubt, sir. Can we not have 24 hours ambulatory measurement instead before diagnosing hypertension?
Who is that? Zainab, this is what I am coming to. This is what I am coming to. The next point that I was going to discuss, thanks for reminding. Anyway, it was in my mind. So 24-hour BP monitoring, that is the in thing now. That is the in thing now. 24-hour because BP, as I said, it's not a static number. It keeps changing from day to night, morning to evening, hour to hour, If you are sleeping, a different BP. If you are awake, different BP. If you are walking awake, BP, different BP. If you are sitting, a different BP. If you are empty stomach, different BP. For after food, it is different. So every minute it keeps changing. You can't every 1 hour, every minute, every beat, each beat the pressure different. Heart does not beat like a computer. Sometimes it may be slow, sometimes it may be fast. I mean, with more force. So each beat, the BP changes. So BP is a dynamic parameter. It is not a fixed number. Therefore, that's the very reason why we don't know what is the normal BP till now. We don't know what is the normal BP. So the 24-hour BP, as Zainab said, 24-hour BP monitoring, that is the in thing now. We have a different apparatus, like it's like a small belt that can be worn on around the waist, and the patient is sent home and we call the patient after 24 hours, and we take it and we feed into the computer. Computer generates the printed report of 24-hour record. It records every hour BP in the daytime, and every half an hour BP in the daytime, and every hour BP in the night. So if the patient has any activity, there's a things to do or things to note list, small booklet that we give to the patient. They should write, I am working this time from this time to this time. I am sleeping this time to this time. I am eating this time to this time. All these things should be noted, so that when the printed report comes through the computer, we can correlate what time is what is happening at what time, what activity the BP is coming up or going down. By this, we can really not only diagnose, but we can also use this 24-hour BP ambulatory. This is called ambulatory 24-hour ambulatory BP monitoring, ABPM, ambulatory BP, ABPM, 24-hour ABPM. This is the latest, and many I have with me. It's available for 1 lakh rupees. It's not cheap. I have many patients I give this 24-hour BP monitoring. So you will know a lot of things, whether we are dealing with right BP, right patient or not, and what is the response of our medication. So you may expect a question on this 24-hour BP monitoring in your medicine paper examination. So please read this. So here, why should we use 24-hour BP monitoring? Because you must have heard about white coat hypertension. White coat hypertension is nothing but when patient comes, many times it has so happens, my students also must have seen, when we check the BP of a patient who is coming to our OPD, BP is high, 180. But you ask, do you have BP to the patient? He says, no, I never had BP. Why the